Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Treating and living with myelodysplastic syndromes, or MDS. Treating lower-risk MDS. The treatment options for people with lower-risk MDS consist of wait and watch, supportive care, immunosuppressive therapy, and medicines recently approved to treat MDS. The following section has more details about these treatment options. Wait and watch. If you have early-stage or very low-risk MDS with minimal symptoms and you don't have a current need for blood transfusions, your doctor may suggest that the best treatment plan is to simply wait and watch. This will involve checking blood counts on a regular basis and keeping an eye on your symptoms. Supportive care. Supportive care is often the best treatment for lower-risk MDS patients. A patient with lower-risk MDS may not need blood transfusions, usually does not have an excess of blasts in the bone marrow. Supportive care can increase blood counts. It can reduce problems caused by infection and too much bleeding. This type of care includes the use of red blood cell transfusions, platelet transfusions, red cell growth factors, white cell growth factors, antibiotics, iron chelation to treat iron overload. Click on any of the underlined terms above to learn more about it. Your doctor may also ask you to take a white cell growth factor along with EPO. This combination can improve red cell counts in some patients. Medicines approved by the FDA to treat MDS. The U.S. Food and Drug Administration, or FDA, has approved 3 medicines to treat MDS. They are azacitidine, Vidaza, decitabine, Dacogen, lenalidomide, Revlimid. Azacitidine, or Vidaza. Azacitidine was the first medicine approved specifically to treat MDS. It can be used by both low and high-risk patients with all subtypes of MDS. In some patients, it can prevent the growth of abnormal bone marrow stem cells and improve blood counts. It can be given as an injection under the skin or as an IV, where it slowly drips into your vein. It is given in a clinic or hospital. In high-risk patients, azacitidine has been shown to improve 2-year survival compared to a group of patients getting supportive care or chemotherapy. Decitabine, or Dacogen. Decitabine and azacitidine are similar drugs. Like azacitidine, decitabine can be used by low and high-risk patients with all subtypes of MDS. In some patients, this drug can prevent the growth of abnormal bone marrow stem cells and improve blood counts. Decitabine is taken as an injection in the vein in a clinic or hospital. Research has not shown that this drug provides the same long-term survival benefits of azacitidine in high-risk patients. Lenalidomide, or Revlimid. Lenalidomide is approved for treating lower-risk transfusion-dependent MDS in patients with isolated deletion 5q, whether or not tests show they have other abnormal chromosomes. It is a capsule you take by mouth, and it can be taken at home. Researchers are not sure exactly how lenalidomide treats MDS. Low-risk patients with deletion 5q have about a 75% or 75 out of every 100 chance of responding to lenalidomide. Many of these patients no longer need transfusions. This drug can also improve anemia in about 25 out of 100 low-risk patients who don't have deletion 5q. Immunosuppressive therapy. With some types of MDS, the immune system may attack the blood cells or the bone marrow cells, which make blood cells. Immunosuppressive therapy uses medicines to keep the immune system from attacking the bone marrow. This therapy helps some MDS patients, especially low-risk patients. The immunosuppressive medicines most often given include antithymocyclobulin, or ATG for short, and cyclosporin. ATG is given by IV, typically for 8 to 12 hours a day, for 4 days. It must be given in a hospital or other inpatient treatment facility. Cyclosporin comes in a liquid or pill form and is taken at home as an outpatient. Positive responses to ATG may last for longer than 2 years. As many as 30 in every 100 MDS patients may benefit from ATG, but doctors are still not sure how to best select patients for this therapy. As with any drug used to treat MDS, the beneficial effects of ATG are temporary. Treating higher-risk MDS. In patients with higher-risk MDS, blast cells will often fill the bone marrow, not allowing other cells to grow. Higher-risk MDS is strongly linked to the development of acute myeloid leukemia, or AML. Most patients who progress to higher-risk MDS will later develop AML if left untreated. In addition to the supportive care treatments, there are a number of options available to treat higher-risk MDS. They include azacitidine and decitabine are approved by the FDA specifically to treat higher-risk MDS patients. Intensive chemotherapy, drugs similar to those used to treat AML. Stem cell transplantation, also called a bone marrow transplantation. Click on an underlined term to learn more. Candidates for stem cell transplantation must be carefully screened. Some of the things your doctor will look at to learn whether you are a good candidate include your general health, your age, other medical problems you may have, the types of donors available to you. For a donor to be a match for you, they need to share some or all of your white blood cell proteins, called HLA proteins. If stem cell transplantation is an option for you, start looking for a donor right away. The first step is to get family members tested to see if any of them are a good match for you. If you do not have a matched donor who is a close relative, your doctor can help you search for other kinds of donors. After a stem cell transplantation, patients may require hospitalization for several weeks. Doctors will also require close monitoring and regular follow-ups with the patient for several months or even years.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Clinical trials. Scientists are always looking for new and better ways to treat MDS. Clinical trials are controlled research studies of new drugs or treatment approaches. Clinical trials, also called research studies, can be a good option for some patients, even those that are just starting treatment. So, before you start any treatment, you may want to talk to your doctor about whether you may be eligible for a clinical trial. Good candidates for a clinical trial often include patients who have tried standard therapies, but it has not made their MDS better, patients who have had MDS return after standard therapies, patients who have not started any treatment yet. Before considering a clinical trial, discuss the possible risks and benefits with your doctor. Clinical trials have several objectives. They may compare new treatments or new combinations of treatments with standard treatments, help scientists learn more about standard treatments, test the safety and effectiveness of new treatments.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Living with MDS. In addition to medical treatments you get, your lifestyle plays a key role in managing your MDS. By taking good care of your body and mind, you allow yourself to be as healthy as possible. Here are some tips. 1. Eat a healthy and well-balanced diet. Although there is no specific diet that is best for people with MDS, getting proper nutrition is important for healthy blood production. Because your nutritional needs can be affected by your disease and medications you take, you should check with your doctor about your individual nutritional needs and the best diet for you. 2. Get the right amount of exercise. It's good for your body to get some form of regular exercise. But if you have MDS, you may not have much energy to stay active. Plus, you may need to take special precautions. Your doctor can help you find the best fitness plan for you. If you have a low platelet count, you should avoid any activities that could cause bleeding. Ask your doctor about safe ways to stay active. Tell your doctor if you get a bad headache or pain. That could mean you are bleeding. If you have a low red count, you should ask your doctor about what amount of exercise and what activities will work for you. Tell your doctor if you have chest pains or shortness of breath when you exert yourself. Tell your doctor if you are going on an airplane or traveling in the mountains. You may need blood cell transfusions to make sure you get enough oxygen. 3. Protect yourself from getting infected by germs. Brush your teeth often to prevent the need for dental work. Dental work can cause infection. Check with your doctor before flossing. Keep minor infections from getting serious. Tell your doctor if you have a fever or feel very tired. These can be early signs of infection. Make sure your food is not too hot. Burns can cause infection in your mouth. If you have a very low white count, you might take these extra steps to protect yourself from infection. Wash your hands often. Carry a lotion that kills bacteria, antibacterial, when you go out. Use it if you can't find soap and water. Stay away from crowds and sick people. Your doctor may recommend a diet to keep germs out of your food and help protect you from infection. Here are some of the things you need to do if you follow this diet. Do not eat any cheeses that say aged on the label. Only drink milk that has been pasteurized to kill germs. Milk you buy from the supermarket is fine to drink. Stay away from homemade fermented drinks. This includes homemade wine, cider, root beer, ale, and vinegar. Stay away from buffets, salad bars, and crowded restaurants. Germs could end up on your food. Wash and peel fresh fruit and vegetables very well before eating them. 4. Relax and reduce stress. Different people react in different ways to having MDS. Here are some other ways to take care of your mind. Join a support group. Learn more about MDS. Speak with a chronic illness counselor. Take an antidepressant medicine if your doctor says it will help you.
Thank you for using Explain.